It's National Stroke Awareness Month, and we'll learn about the signs of a stroke. Does glucosamine really help your joints? And there's help for people with chronic pain. These stories and more coming up next on Sinai-Grace Today. Hello, I'm Melanie Moss. May is National Stroke Awareness Month, and we want you to know the warning signs of a stroke. Stroke is the leading cause of death in the United States, killing nearly 130,000 Americans each year. That's 1 of every 18 deaths.
A stroke is when a part of the brain suddenly stops functioning, and this could happen because a blood clot blocks a blood vessel supplying a part of the brain, or because a blood vessel ruptures causing bleeding into the brain. Common conditions that increase your risk for stroke include high blood pressure, diabetes, high cholesterol, cigarette smoking, the use of illicit drugs such as cocaine, and heart conditions like heart failure or an irregular heartbeat called atrial fibrillation. As compared to Caucasians, African Americans are at a much higher risk for stroke. A simple way to remember the warning signs of a stroke is the acronym FAST. F stands for facial droop, A stands for weakness of the arm, S stands for slurred speech or difficulty bringing out words, and T stands for time. If your loved one develops any of the symptoms suddenly, time is of the essence and you must call 911. Stroke is the leading cause of disability in the United States. The key is that as soon as you develop the signs and symptoms of the stroke, you have to rush to the emergency room. Within the first 4.5 hours, we can offer an intravenous medication called TPA to your loved one, which has been shown in clinical studies to increase the chances of your loved one becoming independent in the long run. In a special group of patients, we can even offer certain procedures such as introducing wires or instruments into the blood vessels of the brain to try to pull out the clot. Be aware of your medical history if you want to avoid a stroke. You should go to your doctor for regular checkups. If you have high blood pressure, diabetes, high cholesterol, you need to be compliant with your medications and take them as instructed to make sure that these conditions are under control. Eating a healthy diet is essential. Fruits and vegetables should be in your diet. You should avoid fried foods and use baked options. And finally, and very essential, stop cigarette smoking, avoid illicit drug use such as cocaine. You should talk with your primary care physician if you need resources in order to help you stop smoking. Sinai-Grace Hospital has stroke specialists available 24/7. For evaluation of patients with stroke-like symptoms either at the bedside or through an audio-video connection so that they can be administered TPA in a timely manner. Sinai-Grace also has a state-of-the-art facility for performing angiograms and pulling out clots from the brains of people in a select group of stroke patients. Finally, Sinai-Grace has a rehabilitation facility associated with a stroke unit, which is run by the Rehabilitation Institute of Michigan to provide a complete range of rehabilitation facilities. After your discharge from the hospital, Sinai-Grace also offers a comprehensive outpatient stroke program where a stroke specialist will evaluate your case, determine why you had the stroke, and make sure that you're on all the right treatments to prevent another stroke from coming on. If you or a member of your family has had a stroke, Sinai-Grace Hospital is where you want to be. You're in good hands.
It's pretty clear to everyone that we live in the age of information. Advice, especially medical advice, is everywhere, from television to social media to the internet. But how do you know what information you can trust? In our Ask the Experts segment, you'll get the straight story from the professionals here at Sinai-Grace. Today we're going to look at the supplement many call a miracle for aching joints.
I've heard glucosamine is good for your joints. Is that true?
Glucosamine can be helpful in joint pain. Several of our patients here at Sinai-Grace Hospital have tried glucosamine, some with good results, some with average results. It's an over-the-counter product, so it can be tried, and if it doesn't work, it's okay to stop taking it.
Did you know it's estimated that over 150 million Americans suffer from chronic pain every year? At Sinai-Grace, we can offer breakthrough treatments at our pain management center.
When I come in this office, when I first met, I was on a cane, barely could make it through the door without assistance, and at home with a walker. And I don't ever want to go back to that if I can help it.
Chronic pain refers to a certain area of pain which is pain persistent more than 3 to 6 months. Various physicians have different definitions. But in general, all physicians agree it's a pain that persisted beyond the expected healing process of the injury. People looking for help at any level, people who usually come to me, they've been suffering for a while, they usually went and saw their primary care physician or an internist who ran some work for them, did simple measurement to try to dull that pain and make it disappear. Usually they failed on the smaller doses of medication. They did not respond well to other therapeutic alternatives such as physical therapy, bed rest, taking over-the-counter medication, for example, some modification at everyday life. They come here looking for something more invasive to be able to help them with that pain. What we try to do here is we try first to identify a source of pain, which is sometimes not easy and sometimes it's complicated because pain can have more than one source causing that to be a complex picture. What we're trying to do is we try to talk to the patient, set with him some realistic goals and expectation. Diet, exercise are the cornerstone of treating these patients, along certain medication. Sometimes we do what we call trigger point injection, which is a small injection in the muscles to relieve the spasm and the pain of them. Sometimes we do Botox injection, which is helped offer them slightly longer pain relief. Certain intensity of patient, of course, does not respond to all that stuff. Certain people respond to a certain degree, and then there is always limitation for them.
So I thank God for that job.
For these stories and more, you can visit our Facebook and YouTube pages for every episode of Sinai-Grace Today. Also, log on to pagingdredie.com for great health information. I'm Melanie Moss. Thanks for watching.